Hello, this is Anthony from Restoring Movement. And if you are experiencing any type of shoulder pain or are recovering from a shoulder surgery, I'd like to show you something that you can start to incorporate to help improve your shoulder health. So when we have shoulder restrictions, pain, limitations, there are usually three components that we need to look at. One, we have to look at the mobility of the thoracic spine. So that region of the spine that all of the ribs are attached to tends to become stiff when we are sitting at computers or on our phones for long periods of time. When our thoracic spine becomes stiff, our shoulders tend to become unstable to make up for the lack of movement there. Likewise, if we have instability of the shoulders from an old injury or something like that, our thoracic spine and our cervical spine might start to become stiff in order to create stability for the shoulders. So it's this catch-22 of the balance between mobile and stable. And in order to do this, we need to address not only the shoulders itself, but we also need to address the thoracic spine and the cervical spine. So what I'd like to show you today is a technique to help activate and stimulate the stabilization muscles of the shoulder through grip strength. And this technique is real simple if you have access to a pull-up bar, and it's just called Deadhangs. So you might find that if you have limitations in your range of motion of the shoulder, having a wider grip might be easier to begin with. So if that's the case, go ahead and start with a nice wide grip, and with your feet on the ground, just start to slowly deload by bending your knees and allow the grip, the forearms, to become engaged as you support your body. Now, as you accumulate time here, you might start off with 15 seconds or 30 seconds. You'll notice that your grip, your forearms, will want to give out before anything else. And if that's the case, that's okay. Hang there for 10 seconds or 15 seconds or whatever you can do. Let go, shake it out, give yourself a rest, and you can come back to it after a few minutes or come back to it later in the day, and then do it again. Ideally, we want to be able to work our way up to a minute, 2 minutes, and maybe even 3 minutes if you're ambitious, to hang with all of our body weight from the bar. Now, as the shoulders health starts to improve and you become a little more strong and the grip strength starts to improve, go ahead and bring your hands closer together until ideally we get to the point where we can have our hands directly up over our heads. Now, when we are dead hanging, there's no need to think about pulling the shoulder blades down and packing and contracting and engaging. Just hang. Allow gravity to do the work. And as you are accumulating more time in this position, allow yourself to release more and more of your body weight until you are entirely supporting your body through the grip of the hands on the bar. Now, it's important to remember to breathe. So I am a big advocate of diaphragmatic breathing, which may be a little more challenging when you're in this position as you are putting a stretch through the torso. But keeping the tongue to the roof of the mouth, breathing in and out through the nose. Feeling the expansion and contraction of the ribs, the obliques, the lengthening of the shoulders, arms, the lateral side of the body, so the latissimus dorsi muscles, you'll feel a nice stretch and pull. And just take your time with this. Now we have this built-in mechanism into our nervous system that when we grip something nice and tight, it activates and stimulates all of the stabilizing muscles in and around the shoulder and the shoulder girdle. So people who have weak grip will tend to have weak shoulders, and vice versa. So if you get frustrated because your grip gives out too soon, that's okay. That'll improve. And that's also a good sign that as the grip strength starts to improve, so too is the shoulder health. So this is an exercise or a technique or something that you can do throughout the day, and it'll help to heal the shoulder, and it'll also help to recover from shoulder surgery as well too. But just be mindful, listen to your body. It shouldn't be painful. In future videos, we'll talk more about some other things that you can do to help get more motion or mobility through the thoracic spine and the cervical spine, and help tie all of this together so that you are nice integrated and you can go and live a happy, healthy, pain-free life. If you like what you see, or if anything of this has been helpful for you, please go ahead and subscribe, like, and if there is a loved one or a friend, someone that you think might benefit from this information, I would greatly appreciate it if you shared this video, and you have yourself a wonderful day.